All right, we're going from politics to medicine. What's the difference?
Oh my God, well, yeah, that's a very good question. Don't get me started on that one.
Okay, Dr. Joel Klein's with us today from Ventana Wellness. And by the way, if you want to talk to him, you're welcome to do that. The phone number is 776-5368. And you don't need an appointment to talk to him today, but we're here to talk about germs, the good ones.
Well, all of them.
Okay.
So that's true, because again, our 130-year war on bacteria turns out that, just like everything else, may be misguided when you kind of declare war on everything.
Right.
And bacteria, I would say, are another group of God's creatures that we need to learn how to have a healthy relationship with.
Well.
And we're reaping the benefits, what we're seeing of this kind of 130-year history, which actually goes back to, well, even more, but Joseph Lister, where Listerine comes from. He was the British surgeon who really pioneered antiseptic surgery, because patients were getting infections, and the prevailing belief at the time was this was miasms. This was evil humors coming in through the windows. And of course they vilified a Dr. Ignaz Semmelweis in the early 1800s for suggesting that having his house staff wash their hands was the reason why his hospital had a much lower rate of what was called childbed fever, where women would get septic and die after childbirth.
Wow.
Because they were being delivered by red house staff who had come from operating on cadavers with bare hands and delivering the babies.
Wow.
So again, good bugs and bad bugs. And what we're finding is that the indiscriminate killing of bacteria is causing, more than likely, and there's more and more research, our problems with improper immune system regulation, with allergies, asthma, eczema type of problems, and autoimmune issues as well.
You know, it seems, Dr. Klein, we're washing our hands more.
Right.
We have these sanitation things at the banks. They're all over the place.
Right.
Is that a good thing?
Yeah, well, again, it depends on what you're dealing with. Louis Pasteur, the father of microbiology, actually said at the end of his life that it was the host, not the bug, that was the determining factor of infections, which of course the Ayurvedic doctors in India were saying in a different way for several millennia. And it turns out, there is a problem, again, when you're dealing with public health issues, when you're dealing with people in restaurants who we don't know who has hepatitis A. We don't know what they have and what they have on their hands. But this antiseptic overuse of antiseptics, literally sterilizing our houses with Lysol and these chemicals, is probably unnecessary. And even things, when children don't get exposed to the right bacteria that are in dirt, and other things like that, then we are having higher incidences of these allergic diseases and asthma. So we're over-sterilizing our world because of the exception part, where we're dealing in environments where people might have immune compromise so that they can't handle the bacteria as well. Certainly in hospitals and all these things, this is a major issue. But otherwise, we've been overdoing it, and of course, there's always been an industry to serve us to do more and more antibacterial soaps and all these other things that, yes, in a hospital when you're trying to contain MRSA is one thing, but in your house is probably overkill.
Okay. Are we ignorantly killing things by what we eat?
To some degree, only if they're antibiotics, in the meat and those kind of things.
Okay.
I think this is more the use of chemicals, both antiseptics and, of course, the use of antibiotics, particularly for the past 60 years or so, that has indiscriminately killed the good bacteria, particularly in our gut, that is causing major issues. And there are scientists, there are people doing all kinds of research now, and even research into what they're calling fecal transplants, where they're taking the fecal material of healthy people and transplanting it into the colon of very unhealthy people who have a very unbalanced environment to restore the bacterial environment. And this is now actually being done in academic centers, not in way out doctors' offices who are really doing more far out things.
Wow. All right. So where's the balance in this? I mean, just take the subject of cancer and how we treat it. It's epidemic, in my opinion.
Right.
It just seems to be epidemic. It's everywhere. I mean, it's indiscriminatory. I mean, it just goes Oh, it's just
Well,
crazy.
This is an issue. What's causing it? How much of it is our environmental toxins? And again, under environmental toxins, I don't want to be a fearmonger, but the environmental toxins, all these antiseptic cleaners that our liver has to process, that we're probably overdoing it with the, with those types of materials. We don't need to use all those chemicals to sterilize the house. Certainly, if you're doing surgery, you're now creating a very unnatural environment where you are bypassing the body's normal immune defenses. You've opened the skin. Okay, that's an unnatural environment. Of course we need to use those. When we were doing unsterile surgery, everybody was dying from septic wounds. But that's an exceptional situation to what's happening in everyday life. I think that's kind of the issue that I want to look at, both in terms of medical use of antibiotics and overuse of antiseptics in the homes. That is probably, there is a balance, there is a symbiosis with bacteria. They're now calling our microbiological environment the microbiome that each of us have. It's an ecological system that we coexist with that actually helps keep our immune system in check.
All right, so what do you do with a patient? How do you get them to check this out? And do you start them on a cleanse? Do you start them with a house inventory? What do you do?
Not really. No, I'm trying to, today I'm really looking at just the general way that we approach things. A lot of times my patients are in probably more specialized situations. A lot of times they're sicker people. So we do have to take other precautions. But I will tell you that a huge number of the chronically ill people that I see through the indiscriminate use of antibiotics, destroying the bacteria in their gut, then start causing overgrowth of unhealthy organisms in the gut, which creates this whole cascade in the immune system with chronic immunological responses to both the bad organisms growing in their gut and more allergies and even inflammatory allergies to environmental exposures in food. So it's more, in treatment it's a different story. I think today I wanted to more address just the common sense things in the housewife, that we don't have to have alcohol wipes for everything. Okay, all that alcohol is getting absorbed in the body if you're doing it to your kids, and that's getting into their system, and they're probably unnecessary to use these real antiseptic chemicals. And in fact, the researchers, Michael Pollan, who's written wonderful things about food, wrote a whole major article about this in the New York Times Sunday magazine a couple of months ago, maybe. And he was talking to all these researchers and asking them, all right, well, now that you know all of this about the microbiological environment, what are you doing differently? Well, we're more likely to let our kids play in the dirt because we're finding out that that's good. We're not being as aggressive with these antiseptic wipes and these kind of things. It's not that we be stupid about it, but the problem is we always swing the pendulum way to the other side where it's unhealthy, where the balance is, as it always is, somewhere in the middle, more using with common sense issues.
What are some of the everyday things that we're doing? I mean, all right, so we use alcohol wipes, that's part of it. You could take this down to dish soaps, couldn't you?
Yeah, I mean, soap is fine, but when we have these alcohol-based chemicals and disinfectants, and ammonia, and you can smell all of it. The soaps, they put a little bit of fragrance in, but when it smells like chemicals, if it smells like a hospital, but we've gotten to the point where we think our house is supposed to smell like a hospital. And I don't really think that's necessary, nor is it healthy.
Well, just good old water, huh?
Soap and water. And it doesn't have to be special antibacterial soap that has been marketed for the purposes, because this is all just preying on fear.
Okay. Now, there's that which is absorbed through the skin and that which we ingest. Right. And so I don't know where you want to go with that, but it appears to me that we are weakening our good germs by, obviously, the diet we're eating. This carbonation's got to be a huge part of that.
Well, it's more all the processed carbohydrates. Same difference again. And even, quite frankly, even the West,
by the way, folks, we're drinking water.
An agricultural-based diet that actually, and they learn this, even, we're eating a lot of cereal grains. It promotes the growth of bad bacteria in the gut. Well, this is what the ancient healers intuited something was going on. So in India, Mom made the yogurt fresh every night to be eaten the next day, because we needed to keep our internal environment nourished and keep replenishing it. And when the daughter went off to be married, those yogurt cultures were the most valuable thing Mom gave her to start her house with her new husband.
Wow.
So it's about taking care of it because there are some downsides to it. But then when we go even farther, and we're not even eating whole grains, we're eating these processed foods and the like, and that fosters the growth of unhealthy bacteria in the gut.
All right. Where does gluten play into this? Because that seems to be huge these days.
Yeah, the gluten issue is a secondary issue. What happens, it seems, is that when people do have these altered environment in their gut, and particularly with overgrowth of fungal species, candida, yeast, which is hard to measure for, but I can usually infer it by the patient's history. And the doctors who do this, there are some very progressive allergists who skin test for all this, and they find that people with the probable yeast problems, because they culture their stool or they look at them, are allergic to all the foods they test, and with gluten being a very common one. So some people have the true celiac problem. I think they're the tip of the iceberg, because for every person that I find that has a positive blood test for celiac disease, I'll find several people whose blood test is negative and they still feel better when they stop the gluten. And it's probably because the altered environment in their gut is producing or contributing to the gluten sensitivity. And when you rehabilitate the gut, they can tolerate gluten better.
All right, let's go to the phones. Hi, Ellen. You're on the air with Dr. Joel Klein.
Good morning.
Morning.
I'm on a cell phone, so I hope that you can hear me all right.
Yeah.
I was just thinking, Dr. Klein, thank you so much for the information you're letting people know about, because, this business of sanitizing everything can be a real issue. One thing is, what could we do? I have found that a dilute water and vinegar solution works really well in the house to wipe down, clean almost anything. And it doesn't have any of the negatives you were talking about. So I just didn't know if listeners knew about that, but
good.
It works great.
Good, yeah. Acetic acid, which is what vinegar is, a natural compound, and we get it in fermented foods and the like. Again, that's fine.
Good.
Well, and that's what I wondered. But It works good in windows, countertops, you name it, it works.
Yeah, it's not like in my big fat Greek wedding when he used Windex, and whenever I cleaned everything with Windex.
Oh, that's terrible. But I just stick like maybe a teaspoon in a quart or so of water, so it doesn't take a lot for dilution. Works great and gets around all this stuff. But thank you for bringing this to our attention.
Great, thank you.
Thanks, Ellen. Nice to hear your voice. All right, let me take a quick break. Dr. Joel Klein's with us today. We're talking about balancing the cleansing of your home, making it sense. And if you have any questions, you're welcome to join us. 776-5368. We'll be right back. All right, we're talking about, chemicals and germs. Dr. Joel Klein's with us today, and he's a physician on staff at Ventana Wellness. And I tell you, if you don't have a good doctor, here's one right here, and he'll take good care of you, and you can check it out at Ventana Wellness. Before we get back into that, let's go take one more call. Hi, Velma. What's on your mind?
Hi, Dr. Klein.
Hi.
I wanted to ask you, what do you think about probiotics?
Well, probiotics are one of the main issues here, because again, when we kill off the good bacteria in the gut, that's part of where we replace them. Now, there's some discussion, there's all these things about live probiotics, whether it's the actual bacteria, whether it's the proteins in the bacterial wall that are stimulating the immune system. These are really important. That's what we're getting in fresh yogurt and all that. Some of these researchers are saying that things called prebiotics may even be more important. Prebiotics are compounds that will feed the good bacteria, these things called oligosaccharides. And so it's interesting, people who use stevia as a sweetener has these what are called fructooligosaccharides in it that actually help feed the good bacteria and nurture those as well.
Oh, really? That's good.
So, but most of the time I use probiotics. I'm not using as much prebiotics. I find they work fine for people, and some people have to use huge doses on. People with inflammatory bowel disease, actually, even medically, there's a prescription probiotic called VSL number 3 that has like 450 billion organisms in it. So this becomes very important, especially anybody who's had a lot of antibiotics, and particularly anybody that I'm giving, if I have to give them an antibiotic. I really try not to, but if I really have to, we make sure they're taking probiotics at the same time and separating the antibiotic from the probiotic by 4 hours.
Right. So how do you determine a good one?
Well, that's a good question. I mean, I've seen good successes. We have these probiotic pearls that people can make. I like this Japanese doctor, Dr. Ohira, has this really good these cultures that he's made. It's called Dr. O'Hara's Probiotic 12, and I think the only store in Medford that sells them is the Healthway Nutrition Center over by the Rite Aid. But that's true. Just like anything else, how do you tell how to tell a good one? And usually it's by the ones that are giving good results, and those are two that I've found pretty useful.
Okay, great. Well, thank you so much. I appreciate
Sure.
it.
Thank you. Now, most of these inflammations in the gut really are the cause of all the problems. I mean, I don't know what causes the inflammation, but the inflammation itself now produces most of the pain and discomfort.
To some degree, actually, it can be any number of things. If you're talking about GI pain and discomfort, that can be ambassadoric acid and enzymes, the food allergies, a lot of those other issues. What we're seeing, and this was shown in an article in Scientific American in 2009, that it's the disturbances in the gut causing the gut to be leaky to molecules like gluten that normally couldn't get through the lining of the gut, stimulating the immune system in the gut, which is huge. That is at the root of a lot of the chronic inflammatory and autoimmune diseases.
Wow. Just a side question. This new trend now, the Greek yogurt.
Yeah.
Is it thumbs up, down, sideways?
It's probably fine, but is it any really better and all that? I don't think. The only really good yogurt for people who have digestive problems is unfortunately the ones that you'll still make yourself and eat the next day. Anything else, the culture counts go way down because of refrigeration and everything else. It's fine. I don't think it's any great, wonderful shakes over regular. It is probably better than any regular yogurt where they just put a bunch of sugar in it, which kind of defeats the purpose.
Yeah, right.
Because that's feeding the good bacteria and the fungus.
Trying to take away that bitter taste, yeah.
Right.
Okay.
It's not that bad. Just put some healthy fruit in there.
Yeah, I know. It's great. Okay. What about inflammation of the joints? That's a big thing, and you're seeing a gazillion products on the shelf for that stuff.
Right. You talk about like even over the counter.
Yeah,
there are some good botanical compounds. There's this one I like called Zyflamen from the New Chapter people. I have a lot of people using. It's an herbal anti-inflammatory that's working pretty well. The big issue here is that the non-steroidal anti-inflammatory drugs, while helping the joints feel better, may be making the situation in the gut worse. There's definite evidence that they actually increase inflammation in the gut, which if you have one of these chronic inflammatory diseases where this leaky gut issue may be playing a role, it's actually going to make it worse. So this is where the treatment that you take to suppress the symptoms is actually making the underlying problem worse, therefore guaranteeing your need to keep taking the medicine to suppress the symptoms.
Okay.
So that's not good. And then we know that the non-steroidal drugs kill 16,500 people a year from gastrointestinal bleeding.
Whoa.
This was published in 1999 in the New England Journal of Medicine.
There you go.
But you don't see them pulling the Motrin IB and the Aleve off the shelf very quickly.
No, you don't.
Yeah.
And then, of course, without that, then you have the high blood pressure issues. I mean, the pain produces that.
That contributes, and even the non-steroidals, and somebody has certain other kidney issues, sometimes those drugs can raise the blood pressure as well. And high blood pressure may also have an inflammatory root to it. All these different issues, again, has to do with inflammation, and one of the best protections against inflammation is the health of the gut.
All right, let's go to, hi, Lori, you're on the air. Go ahead.
Yes, what do you think about agave as a sweetener?
It's terrible. Sorry. When it's been chemically analyzed, it has a higher concentration of fructose than high fructose corn syrup. It is a marketing phenomenon.
There you go. How about that, Lori?
Thank you. I'll throw it out.
Okay, there you go. And then diet drinks, is that a misnomer?
No, because they don't have any calories, but then the chemicals that they're using to sweeten them can be problems. Although, again, they're generally regarded as safe, but the sucralose is chlorinated sugar.
Yeah.
I don't know. And the aspartame would, definitely can cause problems in certain people based on even people can have seizure, mental seizures have been reported, but the aspartame gets turned into methanol in your brain. That's wood alcohol. And the safety of it was questioned. And if you're back in the 80s, Dr. Deborah Davis tells a story that when it was approved, there may have been some corporate influence on the FDA to approve it because the safety data back at that time was questionable.
All right. Let's go back to the phones and let's see if I can get, you guys have to tap it in there. Jeannie? Let's see if we can get Jeannie. Jeannie, are you there?
Yes, I am.
Yeah, go ahead.
Good.
Oh, Dr. Klein, thank you for taking my call. Last year I had a mastectomy, and I had cancer under the arm, too.
Right.
So I was trying to control the edema by wearing a sleeve, which I wore night and day for a long time. Then I cut it off to just wearing it during the day. Recently, I had an infection. I had a bite in my elbow, and it really looked bad.
Right.
So I went to the doctor, got some antibiotics.
Right.
They didn't prescribe any probiotics or anything like that.
They typically don't. They're still waking up to this. Some of the gastroenterologists are getting wise to it. But typical conventional medicine is not doing this yet. Maybe they're waiting for scientific studies to demonstrate that it helps. My feeling is if you're taking something that absolutely cannot do any harm and may do some good, especially if there's a good rationale for it, why not?
Okay. And so a probiotic with an antibiotic is
we're killing the good bacteria, so I think we should be replacing them at the same time. Again, but they need to be separated, otherwise the antibiotic will kill the probiotic. So a lot of times if the antibiotic is being given twice a day, which is a common scenario, I'll have the patient take it breakfast and dinner, have them take the probiotic at bedtime.
Sometimes doctors for pain and maybe even with hives and what's the other one? They're shingles and all that. They'll do the steroid thing.
Right. So the steroids, it appears, may facilitate the overgrowth of bad bacteria and yeast in the gut. So if they're necessary, that's a problem. But again, you need to do it. But again, precautions with probiotics. And with some patients, if they have had a history of fungal problems in their gut that we actually got better with using antifungal drugs, which is still not accepted in medicine, but these patients clearly got better, but they had a significant problem with it. If they're going to take antibiotics or steroids, I will actually give them a prescription for nystatin, which is not a statin drug, even though it's called nystatin. Yeah. But that's an antifungal drug. It's the same thing they give babies for thrush. Oh, okay. And I will give them that for maybe a couple of weeks to also help prevent the overgrowth of yeast in their gut.
How broken down is a person after going through massive amounts of chemo, and what do they do to build those?
Completely broken down.
So what do you do to build them back up?
You need a complete number one, depends on the chemo, but a GI rehabilitation program, which really goes there. Jeff Bland calls it the 4R program, where we remove bad bugs and allergenic foods, we replace acid and enzymes, we re-inoculate with the good bacteria, and we use repair compounds, these herbs like slippery elm, marshmallow root, and those things. And they usually will probably need significant their endocrine systems are shot, particularly the hypothalamic adrenal axis. Maybe even other hormone systems are going to need repair. So their entire body has literally been through a major war, and the entire system, what we would call the neuroendocrine immune system, all needs support.
How long does it take to build somebody back up from that?
Depends on how sick they were to begin.
Okay.
They were pretty healthy, maybe a year or two. If they weren't, sometimes, then it depends on what other pre-existing diseases, if they were diabetic, if they got other issues going on, it can take a long time, and sometimes, you never get back. Yeah. And people talk about chemo brain, that, their nervous system was never quite, their brain function never quite the same. There are some things actually, some of the integrative cancer people are doing that seem to be able to help that, but, you do the best you can.
All right, we've got about a minute left. Dr. Klein, again, most of our discussion today is just, the balance that you want to give people in their chemicals they use in their home is what?
Yeah, and again, beat on the same drum about indiscriminate use of antibiotics for for infections that really don't require it. But, we want something to knock this out. But people would get better without the antibiotics. So people say, well, do I need one? And a lot of times it's, well, you don't need one right now. You get over this. It might take some time. It all depends. Again, most of it depends on the host factors. Yeah. So like Louis Pasteur said, so if I have somebody whose immune system is depleted because they're stressed and their diet is bad, they need the antibiotics.
All right. And the other remedy is maybe you want to take up gardening.
Yeah?
Get your hands in the dirt.
That's not bad. It's more important for the kids. By the time you're an adult, a lot of these things are there, but the kids should be allowed to play in the dirt.
All right. Thank you, Dr. Klein.
Great.
Dr. Joel Klein with Ventana Wellness. Check him out online, Ventana Wellness. And if you don't have a good doctor, he's a great one. We'll see you next time. Thanks for coming in, bud.
You bet. Thank you.